I'm here with the Lieutenant Governor and our legislative leadership and our commissioners who are all involved in COVID-19, this virus. And we're here to tell you in a unified way that I'm declaring a public health and civil preparedness emergency. And let me tell you what that means. We've done this before in the past. We did this with the Ebola virus. We've done this regarding some hurricanes. And we don't do it lightly. Like with the hurricanes, it's in anticipation and preparedness. We do it before the hurricane, just in case. And that's what we're doing here as well. We tried our best over the last month or so as we focus on this, that we do have a contagion. You know, as Susan pointed out in the emergency briefing room there, you see a big red dot over New York and a big red dot over parts of Massachusetts, and we're in the middle. And we got to be prepared for what could be happening. One thing has come crystal clear to me why it's important that we have this emergency declaration is it gives us the opportunity to get more testing capacity faster for all the people of the state of Connecticut. You know, what do I mean by that? I mean that right now there's a collection and there's testing. We're ramping up collection. We're ramping up the ability to do the swabs. We've got a number of hospitals that are going to be setting up their fever clinics outside in less than a week. So we'll be able to collect the samples and do that on a much more broad-based basis so people have some confidence, you know, where they stand. But we still have a tougher time in terms of testing. Commissioner Coleman Mitchell is ramping up our testing capacity at the state lab. We hope to be able to go from, you know, 20 or 25 tests a day up to 60. But we also have a number of private providers here in the state, as well as outside of the state, who are ready to ramp up our testing capacity in a dramatic way. And the only way they can get that done statewide, within the state, is if I have the opportunity and the ability to speed up some of the regulations, the public health regulations that will give some of these amazing providers that chance. What the testing does for us is it means that we can be broader based in what we do. Right now we test those who are most at risk. Maybe we test those who are coming back from one of those tier 2 and tier 3 countries that are most likely to you know, add to the contagion. We'll be able to be more broad-based about that. That allows us to contain this virus as needed over a period of time. I think you're going to find that we've had, you know, 2 cases that have been identified here in the state, a couple of the folks that worked here in the state. One of those cases, I regret to say, had contact with a student in an area called Region 14, which is Woodbury and Bethlehem. And in that area, we've had to close down the daycare facility there, and was recently announced they're going to be, you know, pausing the school system as well throughout that region, Region 14, just as a precaution, just to give people confidence that we're doing everything we can to keep your family safe. And with an abundance of caution, I want to say I'm really proud of working with the legislative leadership here and the commissioners who have stepped up in a serious way, working around the clock to do everything we can to keep you safe. And somebody helping to take the lead on that is our new Chief Operating Officer, Josh GEBALLE.
All right, thank you, Governor. So just to provide a couple of additional details that we can disclose around the second positive case that was we mentioned last night. As the Governor mentioned, this is a female in her 60s who is a healthcare worker at Bridgeport Hospital and a resident of Bethlehem. This case is not connected to the case that was announced on Saturday, I believe it was, of the internist who was making rounds at Bridgeport Hospital, who's actually a New York resident. The source of this person's infection occurred based on a trip out of state in Nevada. So we believe was acquired there, flew home, and was working at Bridgeport Hospital, and is now in care. As the Governor mentioned, as a result, standard operating procedures, you begin contact tracing, and as a result of that, that led to children and grandchildren, as the Governor alluded to, where none of whom are symptomatic at this point, but out of an abundance of caution, you know, the actions are being taken with regards to daycare and the school that I think will be announced by those localities very shortly, probably within the next hour. I think people should understand that we're going to see more of this, right? As this virus spreads, as we anticipate it, We will see similar cases and we will see similar actions, which we think from a public health perspective are the right ones to be cautious, to take the right steps, even if connected relatives are asymptomatic, to make sure we're taking every precaution. A couple other things that we're sharing in the briefing today. We want to draw a special emphasis to the general public. We are seeing an uptick in phishing attacks, so we're on cybersecurity here briefly. Unfortunately, at times of crisis, people see that as an opportunity to try to exploit people's concerns, and we're seeing that now with some phishing attacks going on that are related to masks and supplies and various sorts of things that people are trying to create attention and draw people into cyber attacks. So we've got in the press release some details around that. We're asking people to take extra precaution. And then finally, as the governor mentioned, actually not finally, but picking up on the testing topic, as the governor mentioned, as I've described, I think at previous press conferences, we're really working this from two angles. The first is the sample collection. As the governor mentioned, we're working now with 10 hospitals in this state who are in progress of setting up what we've called alternate collection sites. So these are kind of the drive-by or drive-through sites that enable us to significantly increase the volume of samples that we're collecting without having to drive those people into our emergency departments. That's the key goal here. We have to keep people who are not acutely ill out of those EDs and not consuming the staff and the resources in there. So that's a critical step, and we now have 10 hospitals that are in process of bringing that capacity online. We've already certified one of them through our Department of Public Health. We're doing expedited approvals for those in one day to get that capacity online. So that's kind of the top of the funnel to get more samples in and give us the ability to open up the aperture of who's allowed to be tested, who can be approved through their doctor and through the Public Health Department. And then on to the actual execution of those tests when the samples are shipped out. So we're working this from multiple angles as well. So as the governor said, we've got our public health lab, which is a small reference lab, and we're doing our best to scale that up, but that's never going to be the long-term answer in terms of really getting the testing volumes up. So we have 4 of our major hospitals are in process of introducing their own testing ability to perform tests on site. There's an FDA approval process that they are going through. We're seeing some indication that there may be some shortages of the reagents or the compounds that are necessary to do those tests, and so they're working through that as well. We are also working with the private providers. We've talked, I think everyone's aware that Quest went online with a commercial test last Friday. Last night we were told that they are only accepting samples at this time from the state of California. The lab that they brought online is in the state of California. California, as I think people are aware, has several significant clusters of spread right now, and so they're prioritizing their testing capacity there. We know they have another large lab in Massachusetts, and we've been told that that is intended to be coming online next week. LabCorp is another large commercial testing company. They came online yesterday, and we're working through the process of understanding when we can begin shipping samples to them. And we have a couple other avenues that we're pursuing that we're not ready to discuss yet publicly to identify additional capacity to process tests that we're actively working on. So that's a lot of work that's going on to ramp up our testing volumes. But I think the last point I'll make, and perhaps the most important point, is even once we get that testing capacity ramped up, what we're going to see is a lot of additional, I think all the public health officials are confident that what that will show us is a lot of additional positive tests. As we've discussed for several days, we were operating under the assumption that we have community spread at this point in Connecticut and probably in most places around the world at this point. And so what we've been focused on over the last 24, 48 hours now is taking all of the actions that we would take knowing that we do have community spread and under the assumption that we do have a lot of people out there who probably are transmitting COVID-19. So we've been very aggressive, as we discussed yesterday, on large events. We've been thrilled by the response that we've seen from our municipal partners. Very bold, swift action on events in their towns, in their schools. We've seen action from the high school acronym CIAC, canceling their playoffs. We've seen several St. Patrick's Day parades today canceled. Private sector, we've seen many employers taking similar actions. And so these are all the right things that we should be doing now from a public health perspective to slow the spread of COVID-19, to ensure that our healthcare system has the adequate capacity to deal with the acutely ill patients. Again, knowing that 80 to 85% of people who get COVID-19 will self-recover at home, similar to the flu. They'll never need to go near a hospital. But for those people who do get very sick, we need to make sure that we smooth out the spread so that our hospital professionals have the capacity to deal with those folks. And that's what all these actions are focused on. I would encourage some enterprising reporter to do a little research on where we stand on these actions versus other states. I think we are way out in front on this, and I think that's something that we should all be proud of on a bipartisan basis with state level, at the municipal level, where we're really taking a leadership position on this topic in a way to get out in front of this, even though we have very few tested cases in the state of Connecticut so far.
Yes, you did. Well, that's good. That's good. Good afternoon, everyone. As indicated, Commissioner Coleman Mitchell from the Department of Public Health. I just want to give you some updates. I have to say, between the governor and Josh GEBALLE, our COO, they've pretty much covered basically what I was going to say, so I will just give you some highlights. The Department of Public Health and the Department of Emergency Management Services and Homeland Security instituted our incident command structure as of Monday. And the goal is so that we can continue to enhance our communication among the different sectors in the state, as well as outside of the state with our neighboring partnering states. I want to give you an update on our lab testing. As of this moment in time, we do have 56 patients that have been tested. As you're aware, we have 2 individuals that are positive, and we have 19 individuals currently in the queue for today. I also want to bring up the fact, as it was stated earlier, that we have 2 individuals in the state lab right now that are doing all the testing. And as you can imagine, it's a lot that they're dealing with. And so we have taken upon ourselves to actually train additional staff, additional 7 individuals at the state lab so that we can ramp up the state public health laboratory testing. We're currently doing about 19 to 20 tests per day. With this additional staff that we're training that will be available for testing as of Monday, we will now go to 50 to 60 tests per day. So that more than doubles our capacity in terms of testing. And as it was said, we're a state public health lab, so it's very limited as terms of how much testing we can do, but that's the best that we're working with right now as we continue to do the testing. I also want to bring to your attention that we have reached out to the 27 hospitals in the state in regards to whether or not they would be on board to look at sampling and testing. And I'm glad to report that everybody's in this together, so the hospitals have said absolutely. The next step has been, how do we get there? So effective March 8th, Greenwich Hospital was approved by the Department of Public Health to do some testing and some sampling. Let's keep in mind with all these hospitals, their goal is to keep individuals away and out of the hospital setting. So what these hospitals are doing is looking at how they can have alternative sites or tents or mobile modular units on their campus grounds so that individuals who are symptomatic do not go into the hospital setting, that they are seen, they are sampled, they are tested on an alternate site on the hospital campus grounds. And so right now we're working with several hospitals who are really working towards becoming up and running within the next week or so. I also want to share with you that we as a department are working very hard around the clock in regards to with local health and with these hospitals where we have these 2 positive COVID-19 cases. It's a lot of contact tracing. It's a lot of work. I want to commend the Department of Public Health staff who have worked around the clock, literally, and also local health, and also these hospitals, Danbury and Bridgeport Hospital, who have been phenomenal, and all of us working together in regards to making sure that everyone has been notified in regards to becoming in contact with someone who's COVID-19 positive and getting in to get their testing and their sampling. Lastly, I want to talk about what we're doing as a department to continue the communication. And we're forever trying to strive, honestly, to improve our communications. And so we do get bombarded, but we're still working towards improving that. One of the key things that we want for the general public that are asymptomatic is that we do have the 211 hotline through United Way. Again, that's 211 hotline through United Way. That is for asymptomatic individuals to call and ask general questions, to look at the frequently asked questions. Individuals who do have symptoms, we are asking that they call their healthcare provider and do not use that 211 line as a source of information for them. I believe that's all that I have at this time, and I'll look forward to
The
it.
numbers again slowly. 66 were infected.
No. Let me slow it down for you. I'm sorry about that. There's been, at the state public health lab, 56 patients tested.
Yep.
Out of those 56, 2 were positive.
Yep.
And currently for today, we have 19 in the queue
To be tested.
to be tested.
Included in the 56, or is that in?
In addition, is 19 in the queue to be that are being tested. The sampling is being tested today.
How are the two that have been confirmed cases, how are they doing?
They're doing okay. They're doing okay. We really are relying on the hospitals to provide the services and I guess the care that they need. And our role as public health is really to try to do the follow-up and the contact tracing regarding the folks that they've come in contact with early on.
Senator Haskell had sent out a tweet.
Could I just, 1 second, maybe let the Attorney General just say a couple things, then we'll
Thank
open up
you.
the questions for everybody. Thank you.
Thank you, Governor, for your leadership, and to the legislative leaders and the commissioners. Thank you all for coming together, and Governor, for bringing us together. I think we can all agree this is a moment to stand together and work together to confront COVID-19 and to help each other. And it is a reminder that it is never permissible, particularly in a crisis, to take advantage of your neighbors and your community, and that price gouging, profiteering, taking advantage of your community and your neighbors is wrong, and in the event of an emergency as we have now, it is illegal. And I want to make it very clear that the Commissioner of the Department of Consumer Protection, Michelle Siegel, who's here in the Attorney General's office, will take aggressive action against anyone who uses this crisis as an opportunity to take advantage of people by price gouging or profiteering. Let me just explain that under our statutes, after the governor has declared an emergency, it is illegal to raise the price on any good sold at retail to any price that is not justified by the usual course of business or normal market factors. And if you do that, you could be committing a crime and be at risk for serious fines and penalties. So we have unfortunately heard from our constituents of reports of potential price gouging, things like hand sanitizer and masks. And of course, we've heard about scams and phishing attacks, as Commissioner GEBALLE mentioned. So we want to stay on top of all that. We are on top of it. So if you hear about that, any member of the general public, please contact the Office of the Attorney General or the Department of Consumer Protection or any of your legislators, and we'd be happy to receive that information and act on it. Thank you.
The question that I had was that Senator Haskell had sent something out about Amazon gift cards for the Wilton person who was infected, but I understand they're not doing very well. Can you comment on that?
Yeah, I saw that, and I think our policy is we're not going to disclose individual identities. If they want to self-disclose, that's their business, and if we want to privately support them in our private lives, we will. But we're also not going to comment on the status of patients.
Well, could you then clarify what's the situation in Region 14? Because that's a pretty big deal. So I wasn't quite sure whether you guys were saying that the patient from Bethlehem has a child or has grandchildren in the system.
Okay, let me explain it again.
That's
There's no one positive in Bethlehem. There was, our second positive case was a nurse who works in Bridgeport. Sorry, lives in I apologize. Lives in Bethlehem. Get that right. Lives in Bethlehem. Right. Sorry. Lives in
Bethlehem.
Bethlehem. Lives in Bethlehem. Works at Bridgeport Hospital. Apologies. We're not going to comment on that patient's status, nor any other in the future. You can talk to the hospital about any additional information that they're willing.
How many patients or clients did she administer?
We are investigating that now as part of the contract.
What about Region 14?
What about them?
How does that work?
How does
closing? What's going on there?
Okay,
Commissioner
so,
Cardona.
out of an abundance of caution, when there's a connection of a family member of a positive tested patient, we will, as this region is taking action, out of an abundance of caution, they are closing the school for a period of time until this contact tracing can be done. People have had contact with the person, can be tested, and all the appropriate steps are taken to ensure that the school is safe. And when the local school board determines the school is safe, then it will reopen.
You've praised a lot of municipalities for canceling parades and other large gatherings, and some are critical of the fact that UConn is operating under a different set of rules, that they, unlike other schools which are facing restrictions on travel, can still play sports and go to other states.
Look, we've made our strong recommendations in terms of travel. We've made our strong recommendations in terms of big group activities. At this point, UConn and each local mayor municipality can make their own call. We'll take a second look at that.
Travel under your declaration? I believe you do.
Right now, it's a strong recommendation. We haven't, legally restricted people's travel. No, sir.
When the on-site testing locations roll out, will people be able to get on-site results?
No, it's still going to take, some hours to get a result. And Mark, it's really important, as you heard from the commissioner, we don't want everybody going to these sites. We don't want everybody going to the emergency room. Right now, you need a physician's order to go there. If that changes in time, we'll let you know.
Governor, now that you've declared the state of emergency, what precise actions are you going to be taking? Are you going to be closing any schools, or under your new authority, what are you going to be doing in the next 24 hours?
In the next 24 hours, I'm going to look at the public health regulations and do everything I can to allow more of our local partners here in the state of Connecticut be better able to do not just collection, but testing. That's the choke point right now, in being able to identify people, make sure that those that are infected or contagious are quarantined.
So Region 14 is the only school district that is closing. Is that from K through high school?
I believe that's the entire district for the near term.
So it's the testing that you are most concerned about, and that's why this declaration is going into effect.
Well, there are a number of other priorities as well. I mean, we were on the phone with 700 municipal leaders, school leaders. We heard different issues regarding they may not be able to get reimbursed for a study group that was supposed to travel because they decided to pull back. If we had an emergency declaration, that means they can get reimbursed by them or some insurance providers. But the biggest issue is, I think the choke point is on the testing. Anything we can do, as Josh said, to open that aperture so more people are tested, we know who's contagious, and they are quarantined, is the most important thing I think we can do.
Just to clarify, is the decision in Region 14 theirs at this point, or did you, okay, everyone's nodding.
Yeah, theirs.
And have they actually made it?
Is the State Department of Education guiding districts that they will be waived for this 180-day requirement?
Let me ask the commissioner.
So that that's not a barrier that people are considering?
Yes, we are in constant communication with districts. We have a dedicated communication link to superintendents, and we have staff available all day to answer questions in the hour about their plans on closing schools and whether or not to engage in distance learning. So we are communicating with them very regularly throughout the day.
What criteria will
Will it be are you advising districts that they will be able to actually receive those waivers, that shouldn't be a barrier or something that's a hindrance for them considering to close?
We do have a process for waivers, and that was communicated with district superintendents yesterday. And we have engaged already with several districts who are inquiring about potential waivers.
How many actual
Have
buildings?
you waived 180 days for anybody?
At this point, we have not. It's a board decision.
How many actual buildings are we talking about in Region 14? Are we talking one school? How many school
It's
buildings?
important to remember the decision to close buildings and which buildings to close are based locally at this point and with the direction of the local DPH. The 4 buildings in that area were closed, and part of that was an abundance of caution, but also to make sure that they can clean the buildings, so they're closed for the remainder of the week to make sure that good cleaning happens.
Renee or Josh?
Distance learning that might be available to districts as they close?
We're engaging with districts on plans for distance learning. We've encouraged them 2-3 weeks ago to engage in that process of planning it. So as we hear plans, we'll do it case-by-case basis.
This is for Renee or Josh. At last check, the whole state had 2 test kits. Is the federal government doing any better in helping you guys out?
We participated on Governor participated on a call with Vice President Pence yesterday, where there was indication that there should be additional test kits coming available from the federal government. Although I don't think there's a lot of timing associated with that.
So that is correct. We actually have two kits. Each kit can test up to 600. We, I think the day before yesterday, asked for 2 additional kits to come to the State Public Health Lab.
U.S. is testing at the lowest rate in the world, about 1%. What's the problem with the federal response? What's going on up there, as far as you know?
I can't answer that.
Commissioner, on the issue of the number of test kits or tests don't actually equal people, can you specify how many people per day in the future will be being tested?
That's a good question. So as it stands, generally one patient will give 2 specimens, nose and throat specimens swabbed. And so when I give you the numbers, I was trying to be very, very clear that the number of individuals, people, patients that have been tested, that's times 2, generally speaking, the nose and throat swab, in terms of the test.
So you're looking at how many people being tested hopefully next week at the Public Health Lab?
Say that again?
How many people do you hope to test next week at the DPH lab? You had mentioned numbers earlier.
On an average, we're talking 50 to 60 per day.
People.
People.
Got it.
Correct.
In terms of nursing homes, I know about the visitation restrictions that went out. Do you think there should be greater screening of anybody who goes in those?
Well, there's always going to come from a public health perspective that we're really trying to keep those in the nursing homes, the most vulnerable right now, the most vulnerable nationwide, at the lowest risk possible. So the comment will be that we look at who's visiting in terms of who's going in and how we continue to keep them safe. So we're looking at that right now even more so.
If it becomes necessary to order somebody to be quarantined, and obviously so far in Connecticut the numbers are small and they are voluntarily doing the right thing, who would give that order? Would that be local DPH? Would that be state DPH? What is the intent on how that would work?
So that authority in the first instance now rests with the Commissioner of Public Health. However, the governor is making it clear in this order, it's my understanding, that that authority will be exercised in conjunction on a continuous basis with the local health director and public health authorities locally.
And why is that? Why is that advantageous to have that local?
Because these are people, frankly, boots on the ground. They understand their communities better than anybody, and they have real-time information that they're sharing with the governor and with the commissioner.
We've been informed, Governor, that Vice President Biden is coming here next week for a rally. Do you think that's advisable?
I think you've been informed correctly. We're going to scale the size of this, so it's absolutely appropriate.
What does that mean? 100 people, according to your director?
Something like that.
Have you done anything in terms of working with the National Guard? Because in New York, they're doing that. Can you talk about what your speech travels
So at 1 o'clock, we were notified that the New York National Guard had mobilized approximately 250 of their soldiers and airmen. And they're doing anything from helping deliver supplies to, and their concentration is on the New Rochelle area. So that's what they're considering their hot zone. So they are helping transport nurses to work, to help patients. They're delivering supplies, and they're actually doing all types of those efforts, just like many of the emergency support functions that we have stood up and are planning for in state as well.
You're planning to have that possibly happen here, just in
The
case?
governor always has the option to call up his guard, the Connecticut National Guard, and like you said earlier, prior to any natural disaster, hurricane or otherwise, pre-landfall, this is what we do to prepare. So, and that we are aggressively being proactive to prepare for the worst-case scenario and what we have seen in Washington State and China and other areas around the world.
What does that mean, General? Does that mean like during a snowstorm, you're staging people?
We normally do, yes, sir.
Has the General Assembly made any other decisions about how to proceed with the rest of the session?
Not as of yet.
No.
In terms of mass transit, any message to the passengers? What are you guys doing in terms of, safety transit to make sure that it's safe for everybody?
We're doing an extra special job of keeping things clean, first of all. We're doing that throughout the LOB building. We're doing that obviously in our hospitals as well, in terms of antiseptics and the such. I know that Metro North, for example, ridership is down maybe 25%. I think that's more people are telecommuting, less people are going on roads and rail to get where they want to go. And that may not be such a bad idea for now.
Governor, can you address yourself to people who are going to look at this and say, there are 2 confirmed cases in Connecticut. Do we need to take these further steps? Do we need to cancel sporting events and do all these things? Can you speak to those folks who are...
Let me speak to that. I talked to Governor Washington State yesterday. They're the canary in the gold mine. You saw coal mine. You saw what happened there. I've talked to other governors, and each and every one has given me sort of the same advice. They don't regret that they did too much. They always regret that they didn't do more sooner. And I think that's true here in the state of Connecticut as well. I just want to say I'm really proud of the folks that are standing here. On a bipartisan basis, we have the healthcare professionals front and center. We're working together as a team. We had the Surgeon General from, the Trump administration here. So federal, state, and local are working. We had 700 local officials on the phone yesterday. And I'm not worried about us overreacting. I'm proud of us being prepared. Prepare for the worst, hope for the best. And I think you should have some confidence that this is a state that's working together. And look, it's a fast-changing situation. Every hour something is different. So I can't promise about the future, but I can promise you we're doing everything we can to keep your family safe.
What sort of metrics will you be using then in deciding whether to invoke these additional authorities that these 2 orders give you and the Commissioner of Public Health? I mean, in terms of spread, a fatality, what basically is going to trigger you to say, okay, we're going to do X, Y, and Z?
I'm talking to the experts. I'm talking to the healthcare professionals. They're going to take the lead in terms of what more I should be doing. Talking to the legislative leadership, making sure that we're working within the bounds of what makes the best sense.
But the information that the reason for doing this is to expedite more testing. And I'm a little unclear on how this is going to help with the private sector. I mean, you mentioned that there were some groups like Quest and what have you.
Look, the private sector is going to be doing a lot of testing as well, as Josh mentioned, that's focused on the West Coast. Then they're going to be in the New Jersey, New York metro area. But as I tried to explain on the phone yesterday when we were talking to Washington, D.C., stop thinking about this state by state. When there's a hot zone in Westchester County, Fairfield County is closer to Westchester than most of New York. Think about this on a regional basis and how we can deal with it, and think about it by working together as a team. Hey, thank you, everybody.
Thank you.
Thank you.